Hello everyone, and welcome to Wisdom Waves Wednesday. I'm Swati Gupta, parenting coach, psychologist, and your guide on this journey of raising emotionally strong, healthy, and confident children. Every week, we bring experts who shape the way we understand parenting, and today's topic is truly one and every parent must hear. We have all seen our kids struggle with snotty noses, restless sleep, crankiness, and never ending cold. But here's a big question. Is it really cold, or could it be something deeper like adenoids? So, today we are going to decode the mystery behind the snotty noses, the sleepless nights, the snoring, and to guide us all, we have an exceptional guest, an exceptional expert, Dr. Shashidhar, with 20 years of experience, awarded Best Doctor in NCR, featured in Discovery Channel, and known for performing over 10,000 successful procedures. So we couldn't have asked for a better expert for today's session. So Dr. Sashidhar, we truly welcome you.
Thank you so much, Swati, and it's a pleasure to be here on your platform and talk about it. Something you and I both care a lot is about children, and
Absolutely.
as a parent, it's an immense pleasure for me to be at your service to kind of pitch in and share my knowledge about them.
That is so sweet of you, Doctor, and it is certainly a pleasure to have you here. So I have framed few set of questions. So I'm going to jump into the questions, and I know you're a very quirky and witty kind of a guy. So we want your knowledge, but in the fun manner,
Okay,
because we
I'll
want to
try
see
my
a
best.
different side of it also, not the serious doctor. So by the way, he's not that
Yeah.
serious. Doctor,
Hmm.
doctor, he does serious work, but he
Hmm.
has a different flip side also, which I recently
Hmm.
discovered. So we would like to see your that side as well.
Okay, I'll try my best. That's good.
So, doctor, let's start with what exactly are adenoids and how they are different from tonsils.
So for a parent, adenoids are like a shock. The first time when a doctor says adenoids, they give me this look कि ये है क्या? And then they are trying to kind of see कि we never heard about it. Tonsils तो हमें समझ में आती है. Where did adenoids jump in?
Right.
And to be, honest, adenoids have always been there. It's not something which has come up recently.
Hmm.
But tonsils and adenoids are like brothers and sisters. They kind of
Okay.
grow together.
Hmm.
And a lot of times, right now in this present era, like I'll say past 10 to 15 years, one
Okay.
of the most common cause of cold in children and recurrent nose blocks is actually adenoids.
Okay.
And what we are made to believe is it is all allergy, it is all effects of pollution, which are all contributory. But
Okay.
actually, what is blocking is not the pollution is blocking.
Okay.
Pollution is causing some glands to overgrow, and these glands are on the back of the nose. And when I say back of the nose, in tiny children, they're somewhere right at the back of the nose where nobody can actually see them. And if
Okay.
you just see this chart here, so if this is the nose, see adenoids will be somewhere right here at the back
Okay.
of the nose. So the only way we can actually confirm it is when an ENT specialist puts a camera and sees it, or we take an X-ray, or on a very strong clinical indication that the child is mouth breathing and getting recurrent cold, that we think about adenoids.
Okay.
And when you come to adenoids, they're like immune glands whose main function was actually to give you some immunity. But वो कहते हैं ना देश के रक्षक ही देश के भक्षक बन गए, that sort of a thing. So
Uh,
instead of they becoming your protective organs, they become the source of the infection. And
okay.
even after the cold and everything has subsided, they keep growing, and they block the nose. And that's
Okay.
how these children manifest themselves. Uh, just a small add-on, when we were doing our training 20 years back, this used to be unusual because you could actually see the sky and you could actually see stars at night when I was a kid, even in Delhi. You
Yeah.
know, you would look up at the sky in winters, you will actually see the sky if there are no
Yes.
clouds.
Ha,
Now
ha.
there's no chance you'll see
Yes,
even a
correct.
single star, and if you're lucky, you'll just see some moon there, and that's
Ha.
it. So this used to be a very unusual problem.
Yeah.
Now this has become more common problem, and we'll discuss that as we kind of move on to that.
Absolutely. So tell me, doctor, since you talked about cold, you were saying that sometimes it's like normal cold. So how can
Hmm.
parents differentiate between a normal cold and adenoid-related symptoms, for that matter?
That's a beautiful question. So the first thing is cold is mostly viral, and we say
Okay.
it's a adenovirus or a rhinovirus. And these viruses, when they cause cold, they have a cycle. In first 2 days, there's congestion, blockage. By third day, it peaks in. By fourth, fifth day, you're better. By sixth day, at the most, you're kind of normal.
Right.
But the children with adenoids will not follow the same pattern. They have a cold, and after 5, 6 days, they're not getting better. So you're pumping a little bit of antibiotics, you're giving sprays, you're giving a lot of drops. And once it kind of gets little better, then they actually end up with a cough. And that
Okay.
cough will keep on nagging for 2, 3 weeks, and the nose is still not open fully.
Right.
Then the
Right.
answer is, there is something much more than a simple cold. So if a
Right.
normal cold is just prolonging too much and it is coming in a way, because whenever you get a viral infection, the first thing what happens, your body learns how to treat the viral infection and it can
Correct.
fix it on its own. We saw in COVID, like after first wave or second wave, nobody even
Ah,
cared to do COVID testing because your
correct.
body antibodies were good enough to go and deal with it. And
Absolutely.
this is what the body is such a genius organ that, the immune system trains itself to kind of fix all these little viral colds.
Correct.
But some cold which is persisting for a longer time, it is
Huh.
actually a sinus problem which is called pediatric sinusitis or a chronic
Okay.
sinusitis.
Hmm.
And
Hmm.
one of the biggest reasons for chronic sinusitis is actually the adenoids, which are there.
Okay.
And the other things which why the adenoids are growing, if you ask, the most contributory part is allergies,
Huh.
pollution, and the
Okay.
biggest culprit what we have seen is actually closed ventilation.
Okay.
So when we are given a chance to compare kids here, our kids, we spend so much on their school fees from bus, everything, and all we get is a air conditioning environment.
Environment.
So
Huh.
what happens is like they are on a lower temperature, so your immune system is sort of compromised on a lower temperature. It's not the
Okay.
optimum temperature for your immune system to work. Second
Okay.
point is anybody who has a cold or something, the air is recirculating inside.
Oh.
So when you and
Yes.
I were kids, we used to fight कि कौन पंखे के नीचे बैठेगा. Like there used to be
Uh,
3 fans in a classroom
uh,
or a
right.
window. We all used to fight, and there used to be a cross ventilation. All windows
Correct.
used to be open. That's why you used to look mostly outside. So
Right.
right now everything is a closed ventilation.
Closed.
So
Yes.
the two-tier cities like Panipat, Sonipat, and other places where the schools are still in the primitive ways and they have fans, they actually have less of these adenoids and sinus issues. And
Yeah.
also, when you look at the, early daycares, like all of us are
Huh.
working, and it's a sad thing that parent only gets 6 months off. And
Yes.
usme, you have to have your kid also, you have to do the feeding and you have to make sure that it's good enough to, be taken care
Huh.
by somebody else. So the only option which is left with most parents is like 9 months, 1 year, they put in a daycare center. So
Huh. Huh.
daycare is the fourth culprit. Almost all kids, like I had a list of the bad daycares long back when I used to say कि ये बच्चा तो यहाँ से आया होगा, and they're like, डॉग आपको कैसे पता? मैंने कहा ये इसके एडिनॉइड्स के वजह से पता चल रहा है कि ये यहाँ है. So certain daycare centers, they'll have open ventilation,
Oh
and
my
I
God.
still know the names of those. Obviously, I'll not tell it
Yeah.
openly to solicit,
Uh,
but when you're looking to a daycare center, don't get fancied. They're doing
uh,
pre-learning, they're going this. Just ask the first basic question: is it an open ventilation?
yeah.
How's the air conditioning? It's a centralized air conditioning means
Right.
it's a too much cooling because there's
Uh,
no way to switch it off
correct.
only for that place. So
Yes.
these are the important consideration when you're uh, looking at the kids' health from the toddlers.
Huh. Got it. Perfect. So, what are the top warning signs? Just say one you said, obviously prolonged, uh, uh, anything which is prolonged for a longer time.
Hmm.
For a week, it is like a normal cough, cold, or viral. But if it is
Hmm.
prolonged, it is adenoids. Is that the only way to understand it, or there any more warning signs to tell us that okay, hey boss, now
Yeah.
it's time for you to go and check. So, what is the
So,
right age to evaluate adenoids, and when should parents seek the ENT consultation for that matter?
so the trend is actually decreasing. So
Okay.
first, we were actually screening these kids at 3 years and 4 years.
Okay.
And recently, one of my colleagues, she sent me a patient, which was like 6 month old kid. Okay. And she thought it was, a problem in the windpipe or some serious thing. And when we looked at it, we found out it was actually adenoids. So
My
the
God.
age at which the adenoids are kind of manifesting itself is kind of decreasing from 3 years to 1 year. Now, the youngest which I've seen is about 5 months. So if your question is, what is the age where you should be looking at? Absolutely, there's no age. If your child is not breathing well, if your child is having a struggle in sleeping, the first thing to go and is to check with the doctor to kind of see if the kid has adenoids or not. Second point is, you know, adenoid kids, they're funny. Like they come in two flavors. One would be he's not gaining the weight because their sleep is so disturbed, they're constantly turning this side, that side, trying to
Uh,
get the best position to sleep. So they are like a clock. They go 4 times like this, they'll kick you, again come back, and that's sort of
wow.
a restless sleep.
Okay.
The other ones are the ones which are actually sleeping peacefully, snoring to glory, and you want to make them up. They're like, I don't want to get up. And it's a
Uh,
struggle to make them get up, but they're gaining too much of weight. So one group of
okay.
kids, they
Uh,
don't gain weight. The other group of kids will actually be overweight.
oh wow.
So,
Simple like
so
hyper and hypothyroid with the problem which we
yeah,
have.
yeah, absolutely. It's amazing that, you know, uh, so there's a hormone called leptin, and that leptin is kind of secreted in sleep. So the phenotypes, what we call as, it comes in two flavors. If your kid is not gaining the weight or he's overweight, that's also a screening for adenoids.
Wow.
Most of
Okay.
the times, people screen it when the kid has become the cutest baby to someone with a mouth
No.
open and teeth coming out. You're
Yeah.
already too late
Oh wow.
because the damage of the adenoids has been done. And
Okay.
even if you fix the breathing and everything, it's very difficult to get the dental part corrected. So if the teeth, when you're sleeping at night, they should be mouth should be closed. So the
Uh,
upper jaw and lower jaw, they hug each other and they kind of learn कि तू थोड़ा 1 मिलीमीटर बढ़ेगा तो मैं भी बढ़ूंगा. They're in contact with each other and they're like
wow.
growing together. But
Uh,
once they lose the contact at night, the lower jaw development is less, and the upper jaw, there's a bite difference.
oh
So
goodness.
even they are kind of sitting normally, you'll see that they're breathing with pursed lips, like the teeth are not in the perfect alignment. And that's a late stage to pick up. Like if you're smart enough, you should pick it up much more
Much
earlier
early.
than the dental problems have come up.
Wow.
The biggest, the menace which we see right now is actually hyperactivity. And
Okay.
this is something which was like, it's like exploded like a bomb,
Okay.
because there are good studies which kind of show that almost 30 to 50% of all these hyperactivity kids, they have adenoids. And the simple reason for this is, when an adult doesn't get a good sleep, in the next day, they are kind of sleepy, they are kind of lazy, or
Ah,
they're kind of, you
and
know,
it happens with me. Yes.
low energy. But when a
Right.
kid has poor sleep, they go all cranky because they have not gone into the deeper sleep.
Correct.
So they are super hyperactive, they're irritable, sudden mood disorders, like they're very, very on the edge. They shout and they're very clingy
Uh,
to the mothers. The word I use always is in the clinic is clingy to the mothers, and they
uh,
want things in a certain way. So these
uh,
behavioral changes are also late changes, because over the time, every single night when the kid is sleeping, the oxygen which is falling down and the restless sleep both are actually affecting the brain circuits. So the behavior changes.
oh,
So
wow.
up to a certain age, maybe around six-ish, if you kind of fix the breathing problem and the sleep, their behavior amazingly reverses. Their IQ gets better, their school performance get better, you
Yeah.
know, their eating habits and everything regularizes, their weight regularizes. But if you wait too long, even though
Uh,
you have given a good breathing, the dental
mm,
problems, the behavioral problems, and the psychological problems, they're very hard to fix. So
yeah.
if your question was like, when do you kind of screen it? I'll say as soon as you get the symptoms.
Wow. So why does a 5-month-old or a 6-month-old children are getting it? That doesn't make sense. They're not even exposed to the world. Like we were talking about, how much are they exposed? They would be maximum time in mother's feed. They're not taken outside food. They have probably not gone outside so much. But that is a serious problem in our, in our medical
Yes.
fraternity also.
I mean, I wish I had a great answer for that.
Uh,
But very honestly, we are just perplexed. It's like,
uh,
ye kya ho raha hai? Like, this shouldn't have happened. It's
right.
like now we are seeing very tiny toddlers getting with malignancies. So a lot of
Uh,
this has to do with pollution, AQI, the air we breathe, and the indoor allergens we have. They're all there, but no one has been actually kind of able to pinpoint like these are the three things which cause adenoids.
Correct.
But we know that these are the many things which cause adenoids, and the primary thing would be the allergens in the
Okay.
atmosphere, the pollution, I'll rate it, and the recurrent chain of infections. So, one of the siblings who's exposed outside, like if the kid is 6 months, but he's got a sibling who's two-ish or three-ish, he started going to daycare, and he's bringing the infection
Okay.
again and getting
That can be.
transferred.
Yes, yes, yes.
Smoking is another thing. Like it's a very known fact. If one of the parents is smoker, the children have higher incidence of these ENT infections, right from ear infections to throat infections and adenoids. So we can only kind of give pointers on that, but to answer that question exactly what's happening, it's a very difficult
Very
question
hard,
to
huh?
answer.
Because we are also staying in a very adulterated environment in terms of food, in terms of air, in terms of water. We ourselves are not sure what we are eating because everything is so processed. Even the fruits we are eating. Today I cut a papaya and I realized there was a typical pesticide smell. I immediately threw it because when if I can feel it, then
Yeah,
something would certainly be there. I can't deny that it's not there. So that's why it makes
correct.
us also, I mean, it breaks our heart to see all that, but there's
Yeah,
something we
I
cannot do.
totally agree with you. We should not be in adult hyphen rated environment. So
Absolutely, absolutely. So, what are the available treatments in terms of adenoids? Do all the children with enlarged adenoids require surgery?
it's an interesting question. When we come to the treatment paths, the biggest mainstay treatment for all these children is nasal cleaning with saline washes,
Okay.
which a lot of people actually are sensitized, and pediatricians do a wonderful job in teaching them, and they do anyways. But at
huh.
some point of time, they have to introduce the steroid nasal sprays, and they
Huh.
kind of work pretty good.
Okay. Okay.
And third would be a drug which is called Montelukast, and it comes with a combination with cetirizine, without cetirizine, or something. Now, this is again a gap in our scientific knowledge. 50% of the children would actually respond very well to the treatment,
Okay.
and the other 50% will respond partially. But as soon as you withdraw these medications, they tend to go back to the square one.
Okay.
And there's no way to know which 50% will respond or which will have a partial improvement until you actually give the medications.
Okay.
For a no-brainer, saline washes is the first thing you do. The kid has gone to go football, is coming from outside, like hand wash. And now it's like the nose wash. जाओ
Correct.
सिंक में एक बार saline से wash कर लो. Uh,
Absolutely.
but when you see the nose is getting blocked, uh, seasonally 3 to 6 weeks of these steroid sprays, they're very helpful, and
Okay.
they tend to, kind of pull up a lot of kids. So
Okay.
it's still one of the reasons why every kid is not advised surgery. In fact, if 10 kids come to me for surgery, the first question we ask is like, have you taken the medicines? Have you taken the treatment? And still, about 70% of them wouldn't have taken at least 6 weeks to 3 months of medical treatment
Huh.
because somebody saw in a surgery X-ray, and they are like, "Oh my God, this is adenoids. You should get operated." And then they come for
Huh.
second
Huh.
opinions and other things. So we
Huh.
actually send them back, go back, take this 6 weeks to 3 months. Maybe it will get better, maybe it not. But at
Huh.
least we know that we have tried our best to treat you
Correct.
medically. And now, since the medical treatment is failed, you are more justified to undergo a procedure.
Yeah.
And if it's worked well, then we kind of say, okay, fine, now we give the steering in your hand, you drive it. Another 3 to 6 months of sprays on and
Huh.
off, play
Huh.
around with it, and come back to us if there's something really bad going on.
Yeah. Yeah. Makes sense. So doctor, tell me one thing. Like when I know you operated Ashwika, but when I hear the word surgery, it shakes me so much. So how safe is actually adenoid removal surgery, and are there any common misconceptions which you would like to break today?
Yeah, that's a great question, Swati. So surgery by name is it's like it stops your heart. Like surgery
Absolutely.
means like I can a lot of times I'll have to see if the parent is standing or sitting on a chair, because if
Uh,
he's standing, I'm not going to say the
uh,
word. Please
correct.
sit down first, because we had people where the father was told surgery and he kind of fainted. So
Uh,
before the
uh,
kid, it looks like the father is going to have a surgery for his head. So it's kind of a devastating news, but when you
yes.
look at what's happening inside, they're
Uh,
more like procedures on the level of, let's say, the blood loss or the things which we are doing. It's more and less like a dental procedures or something little more than that. But since it's a
uh,
kid, it is done under general anesthesia. It's done under all precautions. There's a technology involved. There is a training involved, and there's a difference who's doing the way it is
right.
done and other things. But the biggest misconception about the surgery, and it's surprisingly there in a lot of doctors as well, is that the adenoids will disappear at certain age, so we can wait. Now, here's the thing: what happens if you wait? Somebody who's got a bad adenoids and you picked it up at 4 years, okay?
Uh, uh,
This kid will suffer with nose block and poor sleep and this for
in the
next
age of
six
30.
years. Next 6 years, he would have taken 6 to 7 prescriptions of antibiotic medication every year. So he's
Uh,
taken a ton of medicines. He has suffered, and after that, he's getting irreversible damages like the dental and the mouth changes, the behavioral changes, the psychological changes.
yes,
And
yes.
even after that, he's going to have a surgery. So literally, you're not prevented anything. You
We
have
don't
taken
have
the
it.
medicines, you have undergone all the morbidity of the disease, you have suffered it fully, you
Uh,
have still ended up with surgery, and also the long-term problems of the adenoids, you're still stuck with them because you did
yes.
not get it treated at the right age. And this is the
Uh,
biggest misconception. Second part is that they tend to regrow.
okay.
And that's one of the explanations or the hesitations which I commonly hear from parents. Now, the regrow is the typical textbook rate is about 5%.
Okay.
But a lot of these kids, when we do operate, it's like a responsibility. Hey, I've taken your child for treating it, and it's like my own child. So I have to see through it that they don't regrow. And the
Correct.
regrow happens if you don't control the allergens and you don't control the pollutants in the nose. You're not doing
Uh,
saline washes, you're not taking care of your allergies. And even then, it's less than 5% people who will actually require a redo procedure.
my God.
So there's an acid reflux, which we see very frequently in children, that can cause regrow. But all these tiny, tiny factors are the ones you actually determine before the surgery. And you tell, hey, we are going to reset your kid. We're going to give him an amazing breathing, amazing sleep. But the job doesn't end there.
Yeah. You
After the surgery, you got to be very careful. Like Ashwika, we keep saying
right.
that you have to do the nasal washes.
Need to
And
wash.
if you don't do it, it will kind of hit you back.
Correct.
And
Correct.
it's not like a one-time thing. You do a surgery and you can forget it forever. You
Correct.
have to
Correct.
take the care. So
Uh,
that's the second most misconception. The third one is actually a little bit complex.
okay.
When we see the nose, uh, it's rarely just the adenoids.
Okay.
You see the adenoids are there. There is also a tonsils, which is little bit there. Not
Uh,
too much, but not normal, definitely. It's like 50%
uh,
tonsils are grown up. And then we have funny things like swellings on the side, which are called turbinate hypertrophy. It's like the filters
uh,
on the nose, they are grown up too much. And there is something called a deviated septum. The
uh,
center bone is deviated. So most of the time, if the assessment is not proper, a lot of the parents or even the doctors only recommend let's just do the adenoids. That's
mm.
like solving 50 to 70% of the problem. The rest is still
Oh,
left. And it's very important that the assessment is complete and all
yeah.
the potential or the possible blockages are dealt in one go. If it's a
Right. Makes
septum, you're
sense.
doing even, if it's necessary, I'll add the word necessary, you fix it then and there.
Yeah.
If the tonsils look, suspicious that they are going to cause problem in 3 to 6 months, deal it
Mm.
there. So, that wisdom prevents redo procedures,
Right.
gives an amazing level of satisfaction that, hey, this kid, once he got operated, I can say the life before the surgery and the after the surgery.
Correct.
And that typical me before and me after,
Uh,
that
uh,
actually happens. They
uh,
grow, they breathe well, they sleep, they put on weight, their nature, their behavior, everything kind of changes it.
right.
So the assessment should be proper, and the negotiation should not happen with this, like, because a lot of times, like, this takes a lot of our energy. Is like the negotiation is like this. डॉक्टर आपको लग रहा है कि बस नाक ही कर दो,
Uh,
टॉन्सिल छोड़ देते हैं.
uh,
And I was like, okay, so I'm not a carpenter. You want this half
uh,
inch here, half inch there. This is how it is. It's not up to your specification. I have to
correct.
give it to the scientific knowledge and everything. So
Right.
when we kind of try to explain then the reasons for what we're doing and what will
Why?
happen, if
Uh,
a lot of the parents will understand.
uh,
But
uh,
now and then, certain misconception है कि ये septum टेढ़ी हड्डी हम 18 साल पे ही करते हैं. These are like 30-year-old concepts now
uh,
being given away. So when you kind of work on those parts, the surgery becomes a very predictable procedure,
yeah.
and the results are very good.
Okay.
But when you are kind of cutting short on this and you're trying to do, let's just do the minimal possible, then you're better off doing medical treatment because
Correct.
you've taken the responsibility. Let's go operate this kid.
Ha,
Like
ha.
it's on you now. You have to fix every little part. Otherwise, you're better
Correct.
off not even doing a surgery. Why
Absolute.
do all the surgery, procedure, risk, and everything, and then end up doing a half job? That's the fundamental thing.
Yeah.
And basically, these are the major misconceptions about. So the age has nothing to do with it. That
Right.
you have to be 3 years or 2 years.
Ha, ha,
It's
ha.
actually you're fixing the problem rather than actually
Ha.
waiting for the kid to come to a particular age that you're kind of fixing the problems. I'll just quote a little bit of this. When we were residents, we were told that 30-year-old concept, this should be done later. Now, the
Ha.
latest result or the science says if you don't fix this problem, the nose gets much worse, as in the face changes and the palate and everything changes. So you are
Ha.
actually worsening the problem by not operating it.
Yeah.
So
Yeah.
the septum part, which I was trying to tell you, there was a time when you have to wait it. Now, if you wait, it can actually it gets much worse in the later years. That's the
Yeah.
general wisdom right now.
Right. Right. Perfect. So, doctor, tell me one thing. Okay, we've spoken about surgery. I understand. I got my daughter done, so obviously it is safe. But what can parents do if they do not want to opt for surgery, and what can happen to the child if this condition is not treated? So there are two different parts. Let's talk about what can the parents do if they do not want the surgery.
Okay. I mean, with all due respect, when we say no, a lot of the parents, grandparents, they push the kids to alternative medicines. Homeopathy कर लेते हैं,
Hmm.
Ayurvedic कर लेते हैं, and everything. For me, it makes sense because you are not interested in surgery. You want to do everything
Yeah,
what you want to.
yeah.
But here's the key point. Whatever you're trying, you keep a timeline. Like, this is what I'm going to try for 3 to 6 months.
Okay.
And if it doesn't work out, I would go and do the tried and the tested, which has
Huh.
a very predictable thing. So now
Correct.
that every kid we said, let's do a surgery and who has not done the surgery is suffering. I
Huh.
would say there will be a good 10 to 15% who would have tried something, got better, they changed places, something, and they're still okay. And the biggest thing was when we saw this happening in the COVID, like we had kids who were planned for surgery, suddenly there's a shutdown, like complete shutdown, no schools, nothing, no transport, everybody's locked in their homes. And we try to call up these kids, hey, you were scheduled for surgery, you were pretty bad, what's happening? And then they're like, हम तो एकदम ठीक हैं, बच्चा तो बहुत अच्छा सांस ले रहा है, खराटे नहीं है, कुछ भी नहीं है. They fixed themselves, they got cured. And if I remember, that was the only time, you're there, Swati? Hello?
नेट चल रहा था आपका?
Yeah, I think we lost you there.
हाँ, even I realized that there was some internet
Hmm.
issue maybe. But we are
Hmm.
live, so let's continue.
Yeah. So that's what I was trying to tell. Keep they want to try homeopathy or Ayurvedic, they just should keep a timeline. We're going
Okay.
to try it for 3 to 6 months. If it doesn't work out, let's just go and do the obvious thing and get it fixed. The
Right.
only time actually we saw that when during the COVID lockdown, we had
Hmm.
kids who were posted for surgery and they were
Okay.
pretty sick. And they are the
Hmm.
kinds who would require कि within 2 weeks कर लो या 1 week.
Huh.
And
Huh.
when we tried to call them up and we said, you're scheduled for procedure, how's the kid doing? And they were like, he's doing pretty fine. कोई ज़रूरत ही नहीं पड़ी and everything. So
Huh.
all of them, they kind of healed themselves.
Yeah. Yeah.
So,
Wow.
so, and that was the time when we had blue skies and no pollution and no interaction with outside, no air conditioning,
Uh,
recirculating and everything. So, that's the fundamental thing is whatever
uh,
you're trying to do, alternative or other things, keep a timeline, it's working.
correct.
Saline washes and steroid sprays are the ones which should be done diligently. And
Okay.
typically, what parents make a mistake is they will do for 1 week, 10 days, 12 days, and when they have the effect, they kind of withdraw it.
Yeah.
कि
Yeah.
अब तो better है. But
Uh,
typically, adenoid is like a big mass.
uh,
And to shrink it down, it requires 3 to 6 months of
okay.
sprays. So if
Okay.
it so if it has shrunken to 70% down, most of the symptoms will disappear. But pretty much
Okay.
the adenoid is still there. And it will just take
Huh.
2 weeks for it to grow back.
Lovely.
So
Okay.
so you got to be on there and pushing the medicines and saline even though you don't see a
But
uh,
how would I know as a novice? Like, I can't see that whether my, it has become enlarged again,
yes.
or will my
So
breathing affect? What will happen?
so typically what happens is like you should have a radiological proof. आपने एक एक्सरे कराया है before
Huh.
you are decided कि अब और दवाई देने की जरूरत नहीं है.
Correct. Huh.
Otherwise, what makes more sense is in a year आप 3 to 4 months during the worst seasons आप use कर रहे हो symptoms आ रहे हो तो आप at least 3 to 6 weeks दे रहे हो. Giving it
Hmm.
for 5 to 7 days makes very little sense
Got
because
it.
it's not going to fix the adenoid. It's just going to relieve the congestion in the nose, and the
Uh,
benefit is because of that. And suppose somebody has a grade 3 or a grade 4 adenoid, so that's like 75% or 100% block. It takes 5 to 6 months a year for 2 years to kind of cure it. And
wow.
that cure rate is only about 20% of the children will get cured. 80% will still not get cured.
And still keep
So,
suffering.
yeah, so when you look at this, it's like the weighing scale has tons of medicine, sprays versus get a procedure done. I wish we had something which is really good. Like our joke is usually, go to New Zealand or Switzerland and get settled there.
uh,
But that's another,
uh,
it's a very distant thing. But
correct.
you
Correct.
need to really cut down. So a lot of times they say, call the
Uh,
grandparents, stop the
right.
daycare for some time, break the cycle. And
Uh.
misconception here is people will believe all this infection are because हमारे बच्चे की immunity कम है. And
ये तो
what we are
बोलती है.
actually dealing with it is
Hmm.
actually hyperimmunity. Allergy is nothing but hyperimmunity. So there's
हाँ.
absolutely nothing wrong with the immunity. It is
Right.
just we are bombarding our kids with the environmental pollutants so much that the immune system is on overdrive.
Right.
And one of the organs of the immune system is adenoids. And so it is going to grow big. Like you go to a gym and exercise a
Uh,
muscle, your muscle gets bigger. Same
right.
thing. So we are challenging the kids with repeated infections. The adenoids are going to grow, the tonsils are going to grow.
Okay.
But there are 600 glands in the body which can take up the functions. So losing the adenoids and tonsils doesn't cause any effect on the immunity. And
Wow.
that's a research which is more than 150 years old.
Wow.
So the idea is you step down, you kind of make the environment good and reduce the pollutants, but at
Right.
the same time, uh, it's not an organ that you're losing. So it's like your appendix, as long as they're friends, fine. And once they are the problem makers, you
Right.
you gotta get rid of them. That's
Correct.
the general wisdom.
Uh, wow. Wow. So you've already mentioned about if we don't get treated, there will be some, there can be disciplinary issues, there could be psychological issues, and but still, can the condition be really worsen if not treated at the right age or the right way? Or will it be just stable? Like, okay, मेरे को जो हो रहा था जो चल रहा था वही चलेगा. What will happen?
So the worst case scenarios are children going to a condition called sleep apnea.
Okay.
When the kid is sleeping, they're snoring. A lot of times they say, "यार होता है, तो बीच में सांस लेते हैं." But during the sleeps, once in a while, they're like, करके they take small gaps,
हाँ
and
हाँ.
that's a classical red flag. So when that is happening, your breathing is stopping, and the brain is kind of kick-starting it again,
Oh
and
my
this
goodness.
causes effect on the heart. We see these children's hearts getting burned out. There's something called pulmonary hypertension. Their brains are obviously, the wiring is gone haywire. They are prone to so many conditions, right from kidney conditions to uh, heart conditions to chest conditions to early asthma to obesity. And obesity in children itself is like a huge Pandora box.
हाँ.
Because of the sleep apnea, if your kid has become obese, now they have to deal with so many other things like they can't run, they can't lose weight, their joints issue, their image, their self image, everything changes. So when you think a simple adenoids and tonsils, what can it snowball to it? It can go into terrible shapes and sizes, and we've seen all of them.
My
The other
God.
part, like I said, it has two phenotypes. The other one is the failure to thrive. Failure to thrive means the kid doesn't gain weight. And when they are poorly nourished, they lose the appetite. These kids, they become very finicky eaters. Like for you, it's like a 1.5 hours job to go and feed this kid. Uh, their appetite goes down, and the growth gets stunted. If the
Okay.
potential of the child was to have a very good growth, they are short statured. So the other group, which is not obese and they're in the
Yeah.
lean and
Yeah.
failure to thrive, they will suffer all the issues of the malnutrition, like what we say is like it's like one of those
हाँ.
kids who are underprivileged. They will kind of go in that line, except for the part when they get food, they still don't eat. So
हाँ. Correct.
on that
But
part,
हम मतलब with food I think pricky eaters तो वैसे भी होते हैं.
it
मतलब kids
is.
are tricky eaters. It's very hard for मतलब touch wood. Not, I'm not talking about my kids, but
Hmm.
I've seen kids like crazy pricky eaters.
So so there several reasons for it. I'll tell you what happens is when you are having tonsils, there is a predilection for eating liquidy diet and semi-solid thing. So they
Okay.
love shakes, they think this. But when you
Oh.
say ki a roti cow, they're like chewing and swallowing is like a thing. They keep it in the mouth and they kind of do it. So true picky eater hai, yeah, is it because of the big tonsils?
Ah.
Needs to be examined. But what I'm trying to say is one of the things which is also causing the, poor feeding is actually your poor sleep and adenoids and
Ah. Ah.
tonsils issue. So they love like Maggie's like because it's so easy to gulp it down. But if you
Ah.
give something solid to eat like a
हाँ, they
salad
will
or
want it.
this,
हाँ,
they'll
हाँ.
be like माँ गला दर्द कर रहा है नहीं खा सकते and
Correct,
everything.
correct,
That's
correct.
that that's the predilection which they kind of go into it.
Got it. Got it. Perfect. All right. So that solves all my queries, questions, and all that, which I had, and I also got so much of insights despite of Ashwika getting operated from you. I'm shocked to hear all that, because when Ashwika was
Hmm.
operated, then I used to feel कि हाँ नहीं मतलब उसका serious condition था इसलिए करना पड़ा. But
Hmm.
it could be with adenoids also. मतलब if her adenoids were enlarged,
Hmm.
but it was not that enlarged that time, we didn't
Hmm.
realize उसके बाद वो fungal infection and all that.
Yeah,
So
so I just adding, I have two kids. Like one
हाँ,
is 14ish, the other one is about 10ish.
wow, हाँ,
I had to operate for one, the other is okay. So,
हाँ,
like I said, 50% of the kids they respond to medication.
हाँ,
So,
हाँ,
it's like a randomized control trials. Like both the kids got the
हाँ,
medication, the other
right,
one did not get it. The elder one they had to do it. So
right,
we should make all the attempts to give a medical treatment. But when it comes
right,
to surgery, it should not be thought of like, अंदर लाल बत्ती जलेगी और ये होगा वो होगा या तो बाहर
हाँ,
निकलेगा या
हाँ,
नहीं. They're very, very predictable procedures. Like over these years, touch wood, we didn't have a single bad outcome
touch
where
wood.
you are kind of saying
हाँ,
कि, this shouldn't have happened. It has not.
right,
Like nitty gritty, thoda delayed healing, this, all these things
हाँ,
are there.
हाँ,
But
हाँ,
you know, it's that kind of safe. So even in countries like Sweden and other things, like they have a record of 80,000 surgeries, which is, you know, done on
great,
children with these problems, and
हाँ,
the outcomes like complications hote hain, so it's like one or two in that. So the
हाँ,
order of magnitude is like taking a flight.
right,
So
right,
the obviously as a parent, that's the main thing which comes when somebody says
absolutely,
क्या
absolutely,
problem हो सकती है, but
हाँ, हाँ,
uh, most of the times you end up with inadequate benefit because of the poor assessment rather than actually a complication of surgery. That's that's
right.
that's the thing.
Absolutely, absolutely. So I have a few rapid fire also for you, doctor. So
Okay. Hmm.
something fun, not very very serious, but we would like to know your take on those things. Okay.
Correct. Hmm.
So cold or adenoids, the fastest sign that tells you the difference. Oh,
Snoring.
nice. Okay.
Hmm.
One myth parents must stop believing.
Wait till 10 years, it will get fixed on its own.
One symptom that is a huge red flag.
Gasping at night. That's
ये तो मैंने भी बहुत जिनको करते हुए देखा है मतलब हमने मूवीज में देखा है एक्चुअली बट नाउ आई नो दिस इज स्लीप एप्निया मतलब वो तो एंड नाउ आई फील दिस इज नॉट फनी इट इज लाइक
hmm.
सीरियस प्रॉब्लम
And
मतलब
very
इसका
close to that
आई
would be
फॉर मी आल्सो
hyperactivity and dental issues, but is a definite red flag.
वाओ वन होम रेमेडी दैट एक्चुअली वर्क्स
Okay, saline washes,
ओके
and if you are kind of experimental, little bit of manuka honey. So you can order from Amazon. It has a lot of antibacterial properties, and like few drops of it in say about 50 ml.
ओके
You mix it well and kind of use it for wash. That works as a good home remedy. When you are giving steam, a little bit of eucalyptus oil, that kind
ओके
of works well. Turmeric is good, but
ओके
too much of it causes gastritis. So,
हाँ
very little turmeric. And whenever you give turmeric, you have to give pepper as well because turmeric's absorption is dependent on piperin, which is in the pepper. So, most of the
oh
capsules of turmeric which come in the market, they actually have pepper in it.
oh lovely
So, turmeric and a little bit of that pepper, uh, whatever way you're giving it with a spoon or other things, that's
then we give
something.
it in
And
milk is simpler right
yes, milk is
हल्दी
simpler.
का दूध तो फिर भी
And
चिपी
from
देते हैं
from the Ayurveda point, the first thing they would say is stop milk products,
ओके
and curd and other things. We don't have a great scientific evidence to say that.
ओके
But those who really have faith in that from the Ayurvedic point of
ओके
view, ghee and milk and all those milk products. But basically, what you're doing in the body is bringing down the inflammation.
Got it.
So yeah, one answer would be that. So yeah,
Um,
now I made it a essay question. You had to
no, no, no,
do a
it's
rapid
perfect. At
fire.
least it's helping us understand better. Perfect.
Hmm.
One life style change that improves sleep immediately?
Not watching the screen.
Okay.
That's the fundamental thing. Pick up a book, 7ish, 7:30. Go read it to this kids and everything.
Uh,
I wish I was doing that. I only have regrets, but yeah, sometimes my wife does it, but I've known friends who do it,
uh,
and I really admire them for that.
nice, nice. Adenoids in one word.
Okay, speed breaker of your life.
Okay, why do you say that?
Because it's not letting you reach your potential, whatever
Oh,
it is, from the growth point of view, from the breathing point of view,
got it.
anything. So it's like the big speed breaker, which can be easily dealt off.
Okay,
So it's one of those things.
okay. Now we are coming to your personal questions. If not a doctor, what would you be?
I would have been a engineer or a paranormal
Oh,
psychologist.
nice. That's interesting. Paranormal. So why do you say that? I mean, you were super interested in those. You believe it? Paranormal activity? What?
I used to watch a lot of ghost movies and everything, so I was a big fan of the series called X-Files,
Okay.
and I wrote in my, MBBS book that I want to be a paranormal psychologist.
Wow.
It just so happens there's no course for a paranormal psychology in this country. And I'm saved because if I would have become that, my wife wouldn't have married me. So yeah, that's fine.
Wow. Wow. One thing which gives you the utmost satisfaction.
Taking care of kids. That's a responsibility, seeing them smile and coming back and doing well, that defines your life.
Okay.
There's nothing more gratifying than fixing a kid's breathing. And that's something I can just, do it for
Ever. And you're already doing
ever.
it. You're doing a commendable
Hmm.
job. I can see Ashrika improving, so I can't thank you enough. So
Thank you.
it's always been a pleasure. I think you've come into our life like a god because we've seen Ashrika
No,
in a
no,
very
yeah.
pathetic condition
Hmm.
where we were heartbroken to see her the way she was. But I think
She already is a wonderful kid, and it's just when I see every time at follow up, she's like growing taller and taller. It's like the joke which I say is like someday you're going to be holding mama and
uh,
papa in your palms and say, "Hey, mama, how are you doing?"
she's a sports person. She does not like
Yeah,
to sit, so she plays all the sports. That's a trick to it, trick to her height.
yeah. That's amazing
So,
how
one
you've
book which you
really
love
taken care.
reading.
Wow, that's a tough one, but yeah. So my favorite book would be, I would say, uh, I would say maybe Inner Engineering by Sadhguru.
Oh, nice. Oh, a lot of people have told me about Inner Engineering by Sadhguru. Nice. Have you read
Yeah.
it?
So
Like, have you completely read it? Oh,
yes,
lovely.
I read it. I done the course and everything.
Oh, nice.
So,
That's interesting.
hmm.
Lovely.
But I'm not a Sadhguru follower.
Huh,
So,
no, that's separate. I mean, book reading does not
but
mean that you're a follower. It is just to
hmm,
know the
but
inner thing.
but that's a book which kind of brings a lot of the things together, puts into our uh, Indian perspective from the uh, from the religious side to the more scientific side and kind of
Uh,
puts in. So it's very acceptable for self-development book, which
wow.
I kind of enjoyed.
Lovely, lovely, amazing. All right, so we are so thankful to you. Thank you so very much for the clarity, for the guidance, for reassurance, and you have been commendable today and such an eye-opener
Hmm.
session. Thank you so very much, Dr. Shashidhar. It was simply wonderful to have you here.
Thank you, Swati. It was a pleasure, and we thoroughly enjoyed it. Thank you.
Wow.
And I wish you all the success for your. You're doing a great job.
Thank you.
I see that the amount of information and hard work which goes to kind of put in such a program in place for people. It's a really such a passion-driven thing. Full respect.
Thank you. Thank you
Cheers.
so much. And parents, I hope this session helped you understand the hidden reasons behind child snoring, behind restless sleep, behind cranky mornings. So, if your child has been struggling with repeated colds, with repeated mouth breathing, poor sleep, please do not ignore the signs. Early awareness creates healthier and happier kids. And I will also to tag Dr. Shashidhar. Please feel free to connect with him in case you are scared about surgery, you want to take another opinion, you want to understand what is happening. Please feel free to get in touch with him. He is genuinely, I mean, it's a complete tick from my end because I have seen it working with my own child. So he's a no-brainer kind of a doctor. So that is perfectly a yes, yes from my end. And yes, so don't forget to subscribe to Wisdom Waves Wednesday so you never miss this powerful conversation with top amazing experts in the subjects. And thank you so much for joining in. And I'll see you next
Thank you.
Wednesday with more wisdom on your parenting journey. Till then, happy parenting.
Thank you.
Thank you so much, Dr.
Bye.
Shashidhar. Thank you so much.
Thank you. All right.